I got that. Okay. Did you know that 7% of American adults have depression? This is 16 million American adults. Do you know someone dealing with depression? Perhaps you do. Or perhaps they could be dealing with a mental battle right in front of you and you wouldn't even know it. Hi, I'm Lauren Terry, and today I will be informing you about the signs and symptoms as well as the causes and treatments for depression. Major depression disorder is a serious mental health illness, and it affects how a person functions in everyday life. There are certain signs, symptoms, causes, and treatments that are evident in a person who has depression. Credited to Mayo Clinic's online article on major depressive disorder, updated in 2018, loss of interest and sadness are major indicators that someone has depression. Sometimes the sadness gets to be too much and the person no longer feels like their life is worth living. This could be the most troubling symptom, as there are suicidal thoughts as well as recurrent suicide attempts. Some examples of suicide attempts are cutting, overdosing, and hanging themselves, as well as others. Irregular sleeping, such as too much sleep or insomnia, is also an indicator. Weight loss, weight gain, loss of energy, physical aches and pains are indicators as well. I now want to address, I know this subject is hard for some to address, but it needs to be talked about. There are approximately 123 suicides every day in the U.S. Here are some causes for depression. Depression can occur spontaneously, but usually there is something that leads to it. One big example is trauma. This is especially evident if the person experienced the trauma at a young age. For example, if a parent were to get divorced, the child usually acts out and becomes distant from the family. Other lifestyle changes that could cause depression are finances, moving, and relationship changes. Medical conditions such as chronic pain, ADHD, ADD, and anxiety also accompany depression. Even these medications can cause depression. The scientific explanation for depression are changes in the brain. According to the online source, the National Alliance on Mental Health, published in August 2017, studies show that the frontal lobe is not as active in depressed people, as well as changes in the pituitary and how the hypothalamus receive hormone stimulation plays a factor. Now knowing the symptoms and causes of major depression, let's talk about what you would do if you knew someone with depression. Usually the main treatment is medication and therapy. However, there are some alternative treatments. Family therapy, interpersonal therapy, and cognitive behavioral therapy are some common treatments. Some other therapies are light therapy and brain stimulation therapy. Light therapy is when someone goes into a box and is exposed to a full spectrum of light, which helps regulate their melatonin levels. A more holistic approach is acupuncture, meditation, faith, exercise, and nutritional changes. The timeline of knowing when to get help for yourself or when to get help for a loved one is very hard to judge. You don't want your loved one to lash out, but you know something needs to be done. Help is there, you just have to be willing to accept it. People such as your family, friends, faith leaders, and even health professionals can help you. If you think you're going to hurt yourself, call 911 or the National Suicide Hotline, which is 1-800-273-8255. According to an article posted by the Washington Post, Dr. Mike Shooter was interviewed by Anthea Rowan, saying the best way to help a vulnerable child is to establish trust with that child and work on the child's self-confidence. If you or a loved one is in danger of hurting themselves, stay with them. Call 911 or get them to the nearest hospital, which was reported by Mayo Clinic's online major depressive disorder article. As you can see, depression is a very complex mental illness that is not just characterized by being sad. It can impact not only the sick person, but their families as well. We started with an overview of depression today and an interesting statistic that said 7% of American adults have depression. This is 7% dealing with depression, and you wouldn't even know they were dealing with it. Some common symptoms are sadness, distance, as well as others, and suicidal thoughts and actions, and other symptoms. Next, the causes of depression. Some people can go through traumatic experiences, and if they're dealing with these signs, you should probably help them. It is also genetic, so if a family member has ever had depression, you are more prone to experience it. Lastly, the treatment methods that were common were medication and therapy. Don't forget to reach out to family members and friends as well. In closing, I'd like to say this. You and your loved one, if they experience depression, it is never too late to seek help. Do not resort to other methods such as self-medicating and suicide. You are loved. Never forget that. Thank you.